Hello everyone, my name is Nikita Reyes and I am the graduate intern at the Wellness Center. For those of you who are not familiar with where the Wellness Center is located, we are located in Schwartz Hall, room 100. Our mission at the Wellness Center is to provide a warm and welcoming environment that values a healthy and connected community. Our goal is for students to have the knowledge, tools, and awareness that they need to live a healthy and positive life. The Wellness Center at Southern is responsible for broad student health outreach on topics including but not limited to sexual health, tobacco, marijuana, nutrition, stress, and sleep. We facilitate health promotion activities throughout the campus community, including educational sessions, special events, and campus collaboration. I will be providing you all with different numbers, data, and statistics, and all these numbers come from these following surveys. Every other year, we do implement a core and custom survey. The spring semester that just passed, we implemented both a core and custom survey. So once the fall semester comes, we will have all the new numbers to provide to you all. There is a link that is provided on this picture, as well as I will put it in the description box below. And you can feel free to click it and reflect back on those numbers whenever you need to. You can also use them for future projects, future papers, etc. 1 in 2 sexually active young people will get an STD by the age of 25, and most won't know it. I want you to take some time to think about what are some reasons that someone might have an STD and might have no idea as to why. On our 2018 custom student health survey, we asked students who were sexually active what % of sexually active SCSU students always use the condom during intercourse. I want you to take a second and think about what % of men always use condoms during intercourse and what % of women always use condoms during intercourse. The answer is there are 29% of men who are always using condoms during intercourse, and there are 21% of women who are always using condoms during intercourse. So this means there are 71% of men who are not using condoms, and there are 79% of women who are not using condoms at Southern. So I want you to take a second and think about what are some potential reasons that people are not using condoms during sex. In this chart, it shows us the condom use among SCSU students starting in 2012 and ending in 2018. We can see that the number started with 54% of men using condoms and 43% of women using condoms. As the years went on, the numbers began to decrease, and now there are 39% of men using condoms and 29% of women using condoms. On our 2018 Core and Custom survey, we also asked sexually active SCSU students what were the reasons for not using condoms during intercourse. 40.4% said they do not have other sexual partners. 35.2% said they were using alternative types of birth control. 24.5% said they did not feel at risk for STDs. 19.6% said they previously tested negatives for STD. 17.5% said condoms were undesirable. 10.6% said that their partner did not want to use a condom. 10.4% said that condoms were not available. 7.2% said impaired judgment. And 2.2% said they were not trying to prevent pregnancy. At Southern, we do have a free condom delivery service for SCSU students, both residents and commuters. So if you are interested in receiving a free package, you can fill out a Google Docs form that will be linked in the description bar below. You fill it out, request what you would like. So there are male condoms, flavored condoms, female condoms, lubricants, dental dams, finger cots. There are a wide variety of supplies that you can request from. You can only order once a month, but for residents, when you order, we can have the package delivered to your residence hall. And for commuter students, you can come and pick up the package at the Wellness Center. Just make sure you provide a date and time in which you would like to pick up your package. How can you get an STD? You can get an STD through sexual intercourse, oral sex, anal sex, and through kissing, which can lead to herpes or warts. Even if you use a condom, you can still be exposed to genital herpes or warts, which is a benefit of using a female condom. So female condoms are also known as internal condoms. People of any gender can use them for vaginal or anal sex. They have a 79% effective rate. Internal condoms help prevent STDs by covering the inside of your anus, vagina, and some parts of your vulva. This decreases your chances of coming in contact with any semen, pre-cum, or skin that can spread STDs. On our 2018 Custom Health Survey, we also asked students who were sexually active what percent of them were getting tested. So I want you to take a second and think about what percent of men who are sexually active have been tested for an STD, and what percent of women who are sexually active have been tested for an STD. So according to the data that was provided in 2018, 32% of men had been tested for an STD and 48% of women had been tested for an STD. I want you to take a quick second and think about why is it that women are getting tested more than men. This chart provides us with information on the testing knowledge versus the testing rates among SCSU students. We can see that the knowledge of testing, which is the light blue line on top, started at 55% in 2014 and in 2018 reached a 92% rate. For testing rates, which is the dark blue line, we saw that the number remained steady and only 45 to 44% of SCSU students were getting tested. Now we're going to talk a little bit about HIV infection and AIDS. The human immune deficiency virus causes acquired immune deficiency syndrome. 65 million people have been infected since the epidemic began. That's nearly 1% of the world's population. There is no cure to HIV or AIDS, but there is a medicine to help prevent HIV known as PrEP. PrEP is a pre-exposure prophylaxis pill which should be taken daily to help reduce the risk of infection by more than 90%. HIV lives only within cells and body fluids and can be transmitted via sexual contact, direct contact with infected blood, mother-to-child transmission, but it cannot be passed through casual contact. STDs are at an all-time high for the 4th year in a row. The U.S. is experiencing steep, sustained increases in sexually transmitted diseases. We can see in these bars that in 2013, in total cases of STDs, there were 1.8 million. There was a 31% increase from 2013 to 2017, leaving us with 2.3 million cases of STDs in total. For gonorrhea, there was a 67% increase from 2013 to 2017. And for syphilis, there was a 76% increase from 2013 to 2017. For chlamydia, in 2017, chlamydia was the most common condition reported to the CDC, leaving us with 1.7 million cases. Chlamydia and gonorrhea are both bacterial infections that often have no symptoms. The highest incidence are around those who are 15 to 24 years old. A test can be done, and it's usually a urine test or a vaginal swab. Is there a cure? Yes. Antibiotics are usually given to help treat any chlamydia or gonorrhea cases. If untreated, it can cause pelvic inflammatory disease. Test and treatment is available at our health services. 1 in 25 young Americans are infected with chlamydia each year. Continued concerns about antibiotics resistance on gonorrhea has happened, and gonorrhea is expected to eventually wear down our last highly effective antibiotics. Lab tests show a small but growing fraction of gonorrhea samples have signs of emergent antibiotic resistance. The CDC recommends a 2-drug combination to preserve our last highly effective antibiotic. Syphilis can be caused by bacteria and can be effectively treated with antibiotics. Initial symptoms include painless ulcers, which can lead to flu-like symptoms and highly contagious skin rash. Late or tertiary phase include damage to organs, dementia, cardiovascular damage, blindness, and death. Diagnosed by examination of infected tissues and with blood tests. Damage from late stages of infection can be permanent. The human papillomavirus infection, also known as HPV, is a virus that may lead to certain HPV-related cancers and diseases in both male and females, including genital warts and cancers of the cervix and penis. Who gets HPV? 75% to 80% of males and females will be infected with HPV in their lifetime. You can prevent cancer with a simple vaccine. The vaccine is available for free at SCSU Health Services and for all students up to the age of 26. For anyone anyone who is interested in getting the HP vaccine, also known as the 3-shot series, or if you've only gotten 1 out of the 3, 2 out of the 3, or you need the last one, you can go to health services and they will provide you with the vaccine for free. It is available for registered students up to the age of 26. And approximately 1 in 4 people are infected with HPV in the United States every year. And in the United States, HPV causes 30,700 cancers in men and women. Students under the age of 18 will need a guardian or a parent's permission. Anyone older than that, up to the age of 26, can receive the vaccine for free. About 1 in 5 women and 1 in 9 men have genital herpes. 90% of infected people have no symptoms, and it is a viral disease. There is no cure, and once someone has genital herpes, they carry the virus for life. Medications can lessen the frequency and severity of outbreaks. Are there any tests? Yes. A blood test is used to test for herpes 1 and herpes 2. How can we stop the spread of herpes? Here are our top 3 tips. 1. Don't share toothbrushes, silverware, or lip balm. 2. Always use protection. And 3. Wash your hands after touching a cold sore. At the Wellness Center, we do partner up with health services to provide free confidential STD and HIV testing. With COVID happening, we are transitioning to a more safer route. So when that is available, we will be providing you all with the days, appointments, and necessary steps in order to create an appointment to get an STD HIV testing. We will also be providing you all with locations nearby Southern to get tested as well. Here's a chart that shows us different birth control options and how well the birth control really works. We can see that the implant, IUD, and sterilization works really well, and less than 1 in 100 women have a chance of getting pregnant using these birth control options. Next, we have the pill, the patch, the ring, and the shot. 6 to 9 in 100 women have a chance of getting pregnant using these methods. What are some reasons that these methods would be listed as okay and not as really well? Lastly, we have the not so well options, which include the withdrawal method, diaphragm, fertility awareness, and condoms if they are not being used properly. 12 and 24 in 100 women have a chance of getting pregnant using these methods. Here is a list of the different services and resources that health services provides. They have different medical care such as flu and viral symptoms, strep throat, pink eye, acne, Lyme disease. They have different mental health resources in which they partner with counseling services. They offer safe sex and contraceptions, including some of the birth controls that were mentioned previously, such as condoms or contraception pills, the Depot shot, Nexplanon, chlamydia, syphilis, and herpes testing. There are also medications and medical supplies, such as select over-the-counter medications, prescriptions. Pharmacy delivery is also available. And lastly, they also have laboratory and diagnostic services such as strep, flu tests, blood draws, TB screening, vaginal infection testing, pregnancy tests, and much more. I want to thank you all so much for tuning in and watching this video. I hope you were able to gain some new information, some new resources, and become aware of what we provide at the Wellness Center. If you have any questions, please don't hesitate to reach out to me, and I will try my best to get back to you as soon as possible. My information will be provided in the description bar below. Thank you.